Hello, welcome to my video blog. My name's Dr Sarah Coll. I'm an orthopaedic surgeon in far north Queensland, and I'm going to try and answer a few questions about carpal tunnel surgery. So the most common questions I get asked about any surgery is whether or not it's going to hurt, and people's perceptions of pain is very variable, and I think it's important to know yourself and know your past experiences with pain. Compared to other surgeries, the incision is very small and the surgical site is quite small, about 1 inch, which means that compared to other major surgeries, it's actually pretty small surgery. However, it's hand surgery, and the problem with hand surgery is that you use your hand all day long. You knock it, you bang it, you drop things on it, you pick things up with it, you forget that you've injured it, and so it can be a real nuisance. So as far as does it hurt? Certainly, all surgery hurts, but is it really bad? Is it really sore? It's probably on the good end of the spectrum. The second question I often get asked about carpal tunnel surgery is whether or not you can drive. And I always ask the patient first if they're actually holding on to the steering wheel, because I tend to find that people with carpal tunnel surgery don't hang on to the steering wheel. So I tell people that the decision to drive rests with the driver. It's very important to be safe when you drive a vehicle. You should not be too tired, you should not be drunk, you should not be distracted by your mobile phone. If you can't hold on to the steering wheel and maneuver a vehicle into a safe situation in an emergency, then you shouldn't be driving. Very simple. The third question I get asked is about anaesthetics. And carpal tunnel surgery is very successful under local anaesthetic. So it's important to make your own decision. What's a local anaesthetic? A local anaesthetic is when you have a needle into the site of surgery, into the area of the surgery, that numbs any sensation in that area. So it does require a needle to administer. I administer extremely slowly such that the local anaesthetic starts working straight away, and I'm very careful to get feedback from my patient as to whether or not it's hurting. A lot of patients say they just don't want to know what's going on, and they ask me to give them a general anaesthetic, and I'm more than happy to offer that. So I hope that's answered a few of your questions about carpal tunnel surgery, and I hope that's reassured you. Thanks for listening.